thank you for another day. We give you praises. We commit everything that we're going to do tonight into your hands as usual. We ask that you guide and lead us. We commit the speaker into your hand. Father, speak to us through her and let us be able to uh, um, grasp as much as we will be able to, so that it will bless us, and all the glory shall be unto you and unto you alone, O Lord, in the name of Jesus. Thank you, Lord.
Thank you. Thank you very much, Ma. Soji, I have made you a co-host, so if you can help let people in, that would be great. So I want to welcome everyone again. As part of our 17th annual convention lineup of events, we're having this very informative and I'm sure it will be an empowering webinar on controlling high blood pressure and diabetes. We all know that these are two prevalent health conditions that affect millions of people worldwide. I am definitely one of them, and I'm sure that most of us here we have one or both of the conditions, and we're going to get some education today and some practical tips from a renowned doctor. And I'm going to try, because I was trying to look up something that I can read about a profile. And I think I found something. Now I can't find it anymore. I just have to, yeah, here we go. So, I just lose it again. So Dr. Folashade Omole is with us today. She's a professor and the chair of the Department of Family Medicine at the Morehouse School of Medicine. She received a bachelor's in physics from the University of Lagos and a medical degree from Obafemi Awolowo University, Ile-Ife, Nigeria, two of the foremost prestigious universities in Nigeria. She completed her residency training in family medicine at the Morehouse School of Medicine. Dr. Mole is board certified and a fellow of the American Academy of Family Physicians. She is also a licensed practical acupuncturist. So please help me welcome Dr. Sade Omole as she educates us and leads us in this webinar. Thank you for coming. We appreciate you. Thank you for your support of IGSOSANA.
Good evening, and thank you so much, Madam President. It's such an honor to even be considered to be a speaker at this annual convention, Health Talk Convention. So I just want to say thank you for that. And I almost want to say you almost started my talk already by giving us the introduction about diabetes and hypertension, and you stole my thunder a little bit. You know, I just want to say that. But, you know, you're absolutely right. Diabetes and hypertension are the two most prevalent chronic diseases that a lot of us have. In fact, what the literature has said is that 1 in 10 has diabetes and 1 in 4 has hypertension. So, I mean, I'm sure, let me just put both of my hands up. I have both hypertension and diabetes, okay? So, and so it's always good to be able to give a talk from a testimonial point of view as well. I thought the best way to have this conversation is not to just come and bombard everybody with endless PowerPoint slides. I only have maybe 6 or 7 PowerPoint slides. I really want to give people an opportunity to ask me questions after I go through my quick slides. So I'm going to bring up my slides. I had it ready, but I don't think I'm sharing yet, right?
Not yet.
Not yet, okay. All these years of Zoom, I'm still struggling. Okay.
There you go. It's coming up, yeah.
All right, so I chose the title, Let's Get Down With It, like boogie time, So meaning, what do we need to do to make sure we're controlling our diabetes and hypertension? And as we said, diabetes and hypertension are two prevalent diseases. And I said, let's start with numbers. So for those of us that have a history of diabetes, we want to make sure that when we're meeting with our doctors, the target A1C really is less than 5.6. And do we know what A1C means? A1C actually is that marker that helps measure what our blood sugars have been over 3 months. So A1C less than 5.6 means you're not a diabetic. Or if you are a diabetic, then you're well controlled. A1C of 5.7 to 6.4 means you're pre-diabetic and you need to start working on your diet, what you're eating. Try to take out the ion, ebas, and rices, decrease the amount you're eating, and increase your lifestyle. A1C greater than 6.5 means you have diabetes. So I ask that you, or when you all go to see your provider, you need to at least make sure you have once a year A1C measurement. Because what studies have shown is that about 3/4 of us know we have diabetes and 1/4 of us don't even know we have diabetes. And the longer you have untreated diabetes, the more damage you're doing to certain organs in the body. So when you do have diabetes, again, the control, we want to make sure the A1C control is less than 6.5 in our 65 and younger. But those who are older than 65, it's okay for the A1C to even be as high as 8, but no more than 8. In the past, we used to think that 6.5 was for everybody, but what they found is that the older you are, if your A1C is much lower, then the likelihood of your blood sugar dropping really, really low and causing you to fall out or hit your head and harm yourself is higher. So that's why the A1C target goal for 65 and older is less than 8%. So I'll talk now about hypertension. So we all want to make sure that our blood pressures are well controlled. And the target blood pressure should be 120/80. That's the best blood pressure. Now, if you read some literature out there, 2017 guidelines from the American Heart Association says if your blood pressure is less than 130/80, they actually say consider that normal. But I say most of the studies that are done mostly on our white counterparts, because a lot of us Black and browns don't like participating in clinical trials or any studies. So I have to let you know that the treatment we're getting right now is treatment that was studies that was done on white folks that is now being used to treat us. And why is that important to us? I say that because a lot of medications we take are more trial and error, because we weren't part of the initial studies. But we do know that maybe diuretics, the hydrochlorothiazides, and for those of you who might be on blood pressure medicine, HCTZ is the name you might have it as, is one of those that we found works better in Blacks, but it's actually not hydrochlorothiazide that works the best when it comes to diuretics. It's actually chlorthalidone. So I don't have the name written up here. Chlorthalidone works better in Blacks. It's a diuretic, but the horrible thing about it is that it makes your potassium drop more than regular hydrochlorothiazide. And I'll tell you this, there was a hospital that was trying to make sure that their providers was writing chlorthalidone all the time for their patients, because they actually made it a way, because initially if you write for hydrochlorothiazide, we would write HCTZ. The hospital said, for me to get the doctors to write chlorthalidone, I'm going to insist they write out hydrochlorothiazide. So if you're going to write out hydrochlorothiazide, you might as well write out chlorthalidone. So make sure when you go home and you look at your meds, just look at actually right now, I'm saying go home because we're all here, by the way. But right now, if you're on blood pressure meds or diabetic meds, bring them all out and you can start asking me questions about that later. So the different stages of hypertension, and this is just academic reason I just decided to put it here. So when people have, if you have diabetes, the target blood pressure for those people who have diabetes is actually is 130/80 or less is the target for those. So if your blood pressure is 140/90 and you have diabetes, you're doing a disservice to your kidneys. So I want to then now go on to some complications. And these are major complications if you have uncontrolled diabetes or hypertension. And again, what I mean by that is for hypertension, we're looking for a targeted blood pressure of 120/80. But I must say one thing too. If you're an elderly individual, greater than 65, it's okay to have a blood pressure of less than 150/80. It's okay. So you don't have to drop down all the way down to 120/80 because, again, we're trying to decrease the risk of falls in the elderly population or senior citizens. I'm one, soon to be. So hypertension and diabetes, these are some of the side effects of hypertension, heart attack, and stroke. And this happens because when people have hypertension, high blood pressure, right, you have the heart that's working so hard that it either gets so thick or it's working so hard, it just gets tired. So you could have a heart attack from that and a stroke. Heart failure, it also could occur from that. We could have an aneurysm where the vessel actually ruptures, again, from a dilated vessel. You could have kidney damage, and you could even have vision loss. People have had high blood pressure, and you actually have high blood pressure that affects the eyes, and people have lost their vision from that. So I'm putting this up there so that you have to think about ways to ensure that you're being compliant with whatever your doctor is telling you to do. For diabetes, again, it's the same thing. You could have heart attack or stroke. Cardiovascular disease is what CVD stands for. Nerve damage. A lot of time people have tingling sensation in their feet or sometimes in their hand, like pins and needles and whatnot, or even severe pain is, again, coming from poorly controlled diabetes. Again, you could also have vision loss. That's why we tell people who have diabetes to make sure they have yearly eye exams. All right. Foot ulcers. Foot ulcers occurs in those, again, that have poorly controlled diabetes. So that's why we tell people who have a history of diabetes never to walk around with bare feet. So you always have to wear either really, really thick socks or slippers. And that is because when you have poorly controlled diabetes, if you have a cut on the bottom of your feet, since you won't feel the pain, you won't know that, and that can become an ulcer, and it becomes so bad, by the time you even recognize there's something on your foot, the harm has been done, you might even need an amputation. Again, there's also the possibility of kidney damage if your blood pressure is poorly controlled as well. So I'm just giving some visuals. Again, diabetes, the eyes, so make sure you go for your eye exams. For the diabetics, foot exams. And actually for diabetics, you need to be looking at your feet, if not every day, you know, just to make sure there are no cuts there that you have missed. The kidneys are very important. So you need to make sure the doctor has ordered at least a yearly screen of the kidneys. There's a urine albumin is what we do most of the time. And the heart. So we got to protect the heart, right? So again, here they're saying, again, this is from 2017, guidelines of 130/80 or less. But like I said, a Framingham study that was done a long time ago was targeting blood pressure at 120/80 or less. Why can't we get there as well? So if we can get there, that would be great because it protects us more. And remember, we as Blacks are more prone to having hypertension. So when a patient comes in to see us, you know, we don't go straight to medication because everybody hates taking medication. I hate taking medication. So I try to make sure that people understand lifestyle modification, dietary modification, and things that could help lower your blood pressure as well as your diabetes. So if you see here, recommended intervention, lifestyle is about 20% rather, and lifestyle plus medication is about 80%. And when you have and this happens, you want to make sure that you end up doing lifestyle and medication when you have poorly controlled blood pressure. This is just a picture to say, get the the little container where you could put your meds, and you could do your meds for the week, so that way you don't forget to take your medications. What I've seen is when a lot of my patients come in to see me, they might have missed a pill here or there. I always tell my patients, bring your bottles in, bring your pill bottles in. Let me see the last day you filled them. That way it gives me an idea of what I need to do. Because if I look at their pill bottle and I see it's been more than 30 days, but then they still have a certain number in there, that means they haven't been taking their medicine the way they should, right? Then I won't just add on another medication because I've seen their pill and I know they're not taking it. So this is the time we have to sit down and have a conversation to see why aren't they being compliant with the medication. right? Is it the cost of the medication, or is it the time you're taking the medication? Is it because you work daytime or you work nighttime? So we've got to sit down and strategize. So I tell my patients, always be honest, and I'm telling you all, always be honest with your provider if you're being non-compliant with your medication. Because when you're non-compliant with your medication and you don't let your provider know, all they will end up doing is add on another pill and add on another pill. Before you know it, you're taking multi-pills. So that's where we come into polypharmacy, because then you have a lot of patients that are taking about 10 pills for hypertension, 10 pills for diabetes. But it's only because when they check their numbers and their numbers are out of whack, the doctor is thinking, oh, this medicine is not working. It could be the case, but it could also not be the case. So we as providers are also need to be held accountable to have the conversation with our patients to say, why do they think, it's a joint decision making, why do they think their numbers are this way, right? So, oops, trying to move my slide. Okay, the other thing I want to talk about was about vaccines and prevention of complications. So yearly foot exam is extremely important. So for those of us who might have diabetes, if your doctor is not doing foot exams in their own offices, they need to make sure they refer you to the podiatrist. So make sure you see a podiatrist once a year. For your eye exam, and especially if you have insurance, I mean, these are things the insurance pays for. So you definitely need to go for your yearly eye exam. And eye exam is not just for diabetes, but even for hypertension. Remember, we said hypertension and diabetes are two causes of vision loss. But then we also need to think about glaucoma. That is very prominent in Black folks as well. That could also cause blindness, depending on what type of glaucoma they find. Then the yearly kidney exam, like I talked about. Now, we're already in flu season. Flu season is already here. So we need to make sure you get your flu shots. Everybody needs to get their flu shots. And nobody can use the excuse of egg allergy anymore. And for the diabetics, we have the pneumonia vaccine. And in the past, it just used to be pneumococcal 23, but now it's changed to Prevnar 20. So if you got pneumococcal 23 and you're 65 and older, make sure you go back to get the pneumococcal vaccine for valency 20, Prevnar 20. And as we know now, COVID vaccine is now considered a yearly vaccine. There's always a new update to the COVID vaccine. So I'm recommending people get COVID vaccine. And as you know, COVID is back on the rise. So, Madam President, I don't know if we plan to do any COVID testing during the convention, because COVID is back on the rise, and we want to make sure there's a screening tool we can give to our attendees to make sure they don't have any fever, sniffles, or whatever when they attend the meeting, just so that you know. I'm also recommending hepatitis B is also something that's recommended for those who are less than 60 and who are diabetics. So we need to make sure, and it's hepatitis B is three series. So meaning you get one at 0 month, then you get the second in 2, and the 2 months later, and the other one 6 months later than the first one. So if you haven't gotten those, for those who are less than 60 who have diabetes, you need to make sure they get hepatitis B vaccine, especially if they check their immunity and it shows their hepatitis B non-immune sort of. The zoster vaccine, which is shingles vaccine, is also another one. Again, because as a diabetic, one way or the other, our immune system is not the best. So we want to make sure you get the shingles vaccine, and it's 2 series. So you get one, and 2 to 6 months later, you get the second. And that actually is for everybody age 50 and up to have gotten the shingles vaccine. And Tdap, which is our tetanus and whooping cough prevention, you get that every 10 years. So I want to make sure that we remember all these things, because, prevention is always better than cure. And we shouldn't forget aspirin. Aspirin is extremely important. There was a time, probably about 3-4 months ago, there was a study that came out that said people should stop taking aspirin and whatever. And my patients came in and said, Dr. Omole, is it true we shouldn't be taking aspirin anymore? You know what I asked them? Were you in the study? No. The study was mostly done with the white folks. So again, this is not about you. So I'm asking everybody to make sure they're taking a baby aspirin, 1 a day. For our diabetics, actually, because of their higher risk of cardiovascular disease, the recommendation is for them to take 2 81 milligrams. So on that note, I want to make sure we're compliant with our medications, lifestyle, get out there, exercise. I'm going to stop sharing. Get out there and exercise. I see someone's already walking out there. Mr. Saka is taking a walk. So that's a great example right there. And, you know, we need the amount of carbs, our rice, our eba, our ion and everything. It's all about portion control. So, you know, if I go and buy ion somewhere, you know, the ion is wrapped like this, I could eat that ion over 4 days. So I'm not going to eat one wrap of ion at one sitting, but I eat it over 4 sessions. So we need to eat more vegetables. Grapes is very high in sugar, so I recommend people don't eat lots of grapes if you're going to have grapes. Oh, I see another walker in the house, but it's a walker in the house, not out on the street. I see you, Mrs. Derry. So, but you know what we do with our health. Sorry, we need to hold ourselves accountable for our health outcomes, right? So it's a bi-directional interaction with you and your provider, but you overall are essentially the owner of your health and the outcomes that you get from it. So I'm going to end on that note and see if there are any questions.
Thank you. Thank you so much, Dr. Omole. I have a question, and it's relation to the 2 topics that we decided to bring together. I just want to know, does diabetes, can it lead to hypertension? Or it's just 2 conditions you get separately?
So two conditions you get separately. So first of all, it's also genetic too. So, and don't forget, for diabetes, you could have diabetes insulin dependent and diabetes that's not insulin dependent. So you have what we call type 1 and type 2. And there are those that are actually born, meaning maybe within 6 to 10 years of their life, they actually develop diabetes due to the fact they don't have any insulin producing cells. So that's, and sometimes it could be due to some autoimmunity going on within the body. So hypertension, they're 2 different things, but because they're both vascular related, if you have diabetes, there's a likelihood you have hypertension. But if you have hypertension, there's not the likelihood that you will develop diabetes. So it's actually the other way around, right? And then the other thing that's important is that some of the medications we take, especially in our diabetic patients, we need to make sure, especially metformin, we need to make sure that people ask their doctors to get tested for vitamin B12 and also make sure they're also checking on their iron, because if your iron is low, it could also give them a false elevated, what we call A1C. And remember, that's the marker that tells us how one's blood sugar has been over the past 3 months. So the vitamin B12 and iron and CBC rather, are 2 important labs that the provider also needs to make sure is being ordered.
All right, thank you so much. I have one more question, and then I'm going to let Mr. Yemi Adigun ask his question. My other question is about the aspirin, the baby aspirin that you talked about. I was taking it before, and I was one of the people that stopped taking it. And one of the reasons was because I was told, I don't know if it was a doctor that told me, or that if you have acid reflux, which I do have, that you should probably not be taking a baby aspirin 1 a day.
So I'll say yes and no. So usually when we take, so we have to remember that aspirin could cause irritation of the lining of the stomach, and that's why we tell people make sure you eat some food before you take the aspirin to help counter that effect. So if you take it on an empty stomach, it could give you gastritis, which means it could give you an ulcer of the stomach and could lead to bleeding. But if you eat or you drink a big glass of water before you take the aspirin, that counters that effect.
Okay. All right. Thank you so much.
So please go back to taking the baby aspirin, but take it with food.
Okay. Thank you. Mr. Yemi Adigun.
Good evening, Dr. Omole.
Good evening, sir.
My 2 questions are these. You just spoke on aspirin, baby aspirin. What is the effect of baby aspirin and Xarelto? Because I'm taking Xarelto. At the same time, I stopped taking the aspirin long time ago. Okay. But what are the effects? Can I take the 2 together or not?
So it depends on why they gave you the Xarelto before. So if there was a history of heart attack or stroke, then they will put you on Xarelto. So especially if you end up with a maybe ending up in the cath, what we call the cath lab, and they found some occlusion of the vessels leading to the heart, then sometimes they do put people on a combination. If you have a stent, they might put you on a combination of both Xarelto and aspirin. But you really don't need to be on both, depending on your medical history, which I don't know. But you know, that's a conversation you'd have to have with your primary care provider.
Okay, thank you so much.
Yes, sir.
The second question is on the numbers you get on when you check your blood pressure.
Mhm.
Okay, what is your recommendation if I check my BP in the morning and it's reading 130/70,
Mhm.
and in the evening, maybe noontime, I feel dizzy or something like that, and I decided to check, and the numbers went out of this world. What is your recommendation of what am I supposed to do? Because most of the time, when the my blood pressure goes up like that, which is around 140/90 or something like that, so many doctors I talk to, different opinions.
So what is the number it goes high up to?
The highest one I've had for the past 6 months, about 145. And then the middle one, which I believe is the most important one, is 90.
Okay.
And at the same time, hold on, and at the same time, sometimes it goes below 70. Am I safe to go after lower than 70 or what?
So, you know, I have to say something. I know there are other medical doctors on. So I'm just going to go to tangential right now to say that sometimes we have people whose blood pressure could be as low as 90/60, but there's something we calculate to see are the vessels perfusing well. And there's a number we look for, and if that number, and if it's within that range, then we'll say even those that have 90/60, it's okay, but make sure you're drinking Gatorade or Powerade. But what I just said before you came on, that for people who are 65 and older, you know, if you have a blood pressure of 150/90 or less, you're okay. So 150/90 is okay for you, for someone who's older than 65. However, I'd love for the target to be less than 130/80. So if your range is between 130/80 to 150/90, that's okay for you. What I would always tell people is to keep a log of your blood pressure, because you can't just take a one point in time blood pressure and want to do something with just one value. So you need a value over a period of time.
Thank you so much.
Yes, sir. But I did want to say, you did say when the blood pressure goes up, it goes down. When do you feel dizzy? I heard you say something about dizziness.
Right. Sometimes I do check it up. And once I check it, it's like 145/90. Okay. And at that time, I sometimes feel dizzy. I just say to myself, why am I feeling dizzy? Is it because my BP went up or not? So I begin to wonder within myself. I really don't. Well, I always call the doctor. Hey, what should I do?
So actually, honestly, I'm surprised you feel dizzy with a blood pressure of 145/90. That's a great blood pressure. So if it had dropped down low, even though, you know, if it went up to 180/110, then I'll be concerned, because then I'll say, okay, there's a hypertensive crisis going on, right? So the other thing I'll look at is that when was the last time you had breakfast? When did you have lunch? So everything is not just related to the blood pressure, it's also related to what you've eaten or not eaten at that time as well.
Oh, okay. I got you.
Yes, sir.
Thank you. Thank you so much.
You're welcome.
Thank you. Anybody else? Any other question? So one of the things I wanted to ask, I know we have quite a number of doctors on the line, and I know some of them are going to be attending the convention. Is it possible for us to have, during our Obu night, to have a small, maybe like a chair and a table at the back, and do some screening for blood pressure? Would that be a good idea? I don't know. Some people might not have taken their blood pressure in a very, very long time and be shocked. And be shocked to
after Obu and bread.
not after. They can just be there, and we can have like a home one, which I think is good. That we can check people's blood pressure. I'm just thinking.
If they want to.
If they want to, yes, oh yes, if they want to, it's a voluntary.
But the liability there is that if you find someone whose blood pressure is higher than, what we expect, what's the plan of action?
Oh, we just tell them to go to see the doctor. So see their doctor, at least they will know there's an issue. Some people don't even know, and they're just walking, and that's how people just drop.
Okay.
All right, I'll let Folake ask a question. Please go ahead, Folake.
I'm sorry, that was a mistake. I don't have any
Okay.
question. Thank you.
All right. Thank you.
So I do have a comment though. So I'm assuming that everybody who's on, if you have hypertension or diabetes, that you all know what your numbers are. Because we have to, when you go to the doctor does all these tests. Are we all aware of what our lab values are, what they mean and whatnot? Or we just say the doctor said everything's okay and that's it? Because again, a lot of these doctors are, I hate to say it, what I found out, depending on the color of the doctor you're seeing, impacts outcomes as well, right? So, I want to make sure that you have you two are knowledgeable. And anyway, I know a lot of us are Googling, few patients coming in and say, I Googled this, I Googled that, and whatnot. So the other thing I want to talk about, say that again, Mrs. Derry.
Oh, yeah. I'm sorry to take you back. Concerning the aspirin, I just have a quick question. Can you hear me?
Yes,
Yeah.
yes.
Thank you very much for this lecture. It's very informative. The aspirin, if you take it for some time and you have nosebleed, is it good to stop it for a period of time and start it over again, or you need to check your platelet, or what should we do?
No, so if you have nosebleeds, again, what's going on? Is it due to the temperature in the house, or are you a nose picker? Is your nose dry? So the aspirin alone would not cause nosebleeds unless it's a nosebleed that you ended up in the emergency room for, right? And how heavy is the nosebleed? So a periodical nosebleed, which could be due to maybe the room was hot, or your nose was dry, or you picked your nose, those are different things. So I have to know the full history. So could you tell me more?
Well, it happened only the period when I was taking the aspirin, and when I stopped, the nose, it wasn't a lot. It's like you blow, you see a little streak of blood.
Mm-hmm.
And then when I stopped the aspirin, it stopped.
And did you try to start it back again?
Yeah, no, I didn't.
I would try and start it back again just to check, to make sure, is it truly the aspirin?
Okay.
Right? And because usually the effects of one aspirin lasts about 3 days. It inhibits what we call the platelets. But again, if you're having nosebleed that's constant, you could go to your doctor, have your iron checked through CBC and platelets, like you said. But again, the aspirin inhibits the platelets for about 3 days. That's why if you're going for any surgery, they ask you to stop the aspirin for at least a week before the surgery.
Okay. Thank you.
My pleasure. So don't forget to put Vaseline up your nose next time.
All right.
But just even the saline spray will also help.
Yes, ma'am.
Yeah, because I do have that issue too. All right. Any other question? All right. Well, thank you so much. Dr. Omole will be at our convention. I'm just saying this, I don't know if she's going to be available, but I'm sure she will be. If you can grab her and ask your personal questions, if you're not able to ask.
Oh, I did have one more comment.
Okay.
I did want to say, especially for our men, it's important too. So if your blood pressure is well controlled and your blood sugar is well controlled, then you would have great erectile function. So people have erectile dysfunction because blood pressure and diabetes is poorly controlled, because we have to remember that it's the vessels, it's blood flow to the penis that causes a strong erection. So that's why the aspirin probably would also be helpful too. So I just want to throw that out there. So good blood pressure control and blood sugar has a great impact.
All right. Thank you.
Interesting.
Thank you so much. Any question about that?
Hello?
What's the solution?
Now everybody wants to talk to me. I'm not talking anymore.
Oh boy.
All right. So she will be there at our convention, and I'm sure that if you have any other personal question, I mean, she is not your doctor, but she'll give you an advice and probably advise you to also see your doctor. Thank you so much, everyone. We appreciate your attendance. We'll see you all in St. Louis in a couple of days. And Johnny Mercies, thank you. God bless you all.
Thank you.
Thank you.
It was a pleasure.
Thank you, Dr. Omole.
My pleasure. Thank you.
Thank you so much.
Thank you, Dr. Omole.
Thank you.
Thank you.
Thank you.
Thank you, Dr. Male. How is the attorney doing?
Mhm.